Welcome to this Fireside Chat. We're going to talk about investing in crisis response, and I happy to say, I'm Bianca Prince. I am an accessibility advisor with my own company, which is called CV Works. I've been working in banks for a long time, and part of the roles I had was actually in environmental and social risk. Next to me is Renate Bauer-Richter. She works in Abu Dhabi as a disability inclusion consultant. And please, can you share who you are, Renate?
Absolutely. So I'm, as you said, inclusion and accessibility strategist based in Abu Dhabi, associated with the FIA, Institute for Inclusion and Accessibility there, and we are a think and do tank. So we work on innovation, we work on piloting, we work with the public and private sector, also on crisis response.
Exactly. And interesting enough, a lot of people don't realize that crisis response is so important to be inclusive right from the start. What we noticed, and that's one of the reasons why we wanted to do this talk for you today, is actually that if we look at it, and we're also quite nerdy researchers every now and then, we found out that everybody talks about 15% of persons with disabilities. But if you look into the numbers, or you go a little bit deeper and you find different research, you see that we're talking about 30% of the population having a disability. And if you go up looking in age groups, elderly, even 1 out of 2 people experience a disability. Those groups also need to be supported in the right way when there is a crisis. What we currently see, and people probably have seen it also, for example, what's been happening in Ukraine, what you see happening in Gaza, you see a lot of people with disabilities impacted. But it can also be near your house when there's a flood. You also need to be supported in a safe way. And one of the things we really believe in is if you are investing in a strong and good crisis response system, it's important to make sure that you also think about people with disabilities and that you're ready. So we've prepared some questions for today, and we hope to bring our insights, mine from how to work on it, and also Renate's what she learned in Dubai, Abu Dhabi. Sorry, I always say Dubai. Okay, so the first one: why people with disabilities, or why are people with disabilities not seen as equals in case of an emergency? Think about the fact that people in a wheelchair are often supported last in a crisis situation. So how can we close this gap? And are there initiatives that empathize to involve persons with disabilities from an early stage in developing inclusive crisis response?
Okay, I mean, Bianca, what you did is you framed the entire essence of this year's Zero Project, right? And I just come fresh out of a session called Crisis Response, led by people with disabilities. And I think this would answer your question in a sentence: led by people with disabilities. But let's just go back for a second and look at the assumption that lies underneath each crisis response plan. So, and when you look at these architectures of these plans, they are designed for the default human, the person who's able to hear the siren, the person who's able to understand the instructions, the person who is actually able to exit a building in case of any emergency. And we all know these are default humans that are kind of fiction, right? And the further you are from the default, the closer you are to danger. And for persons with disabilities, this distance can be fatal. And you mentioned people using a wheelchair. So at least this is what crisis response managers have in mind when they talk about accessibility in crisis response, right? This is a category. So they think about ramps, they think about evacuation chairs, but they don't think about the more than 80% of people with disabilities with non-visible impairments. And I think this is the level of discussion that is not happening right now. So, and because disability is intersectional, it's deeply individual. And what we see is, and I think you mentioned it in our earlier conversation, sometimes if someone is really interested, they invite a person with a disability, but they don't invite experts, they don't invite multiple people with a broad range of disabilities. So it always, is a kind of fictional response to an emergency, and it's never designed for the actual users. And I think what really works, back to your question, is co-production. Co-production where people with a broad range of disabilities are actually involved in the design and the delivery and in a constant feedback loop, because everything else is just consultancy, and this is insufficient.
Especially the constant feedback loop. That's one that really has been staying with me all the years working in accessibility, because you can set requirements and you can write them down in the best policy ever, but you constantly have to revisit and renew because we see things changing. And I think that's one of the crucial things also. It's not just about being ready for crisis, but it's also about revisiting. If we continue to build on that, especially thinking about why should disability inclusion be in scope of municipalities and governments to make sure that their crisis response policies, but also the action in the end, when in the trainings, for example, that disability inclusion is included there. Could you give a little bit depth to that?
Absolutely, and just to make it simple, accessibility in a crisis response model equals independence. That's it. And if a person who receives a warning understands it, acts on it, and reaches safety without depending entirely on someone else, that matters at every level. And on a municipality level, that means the warning systems, the evacuation routes, the shelters, and accessibility alerts have improved, particularly for people with visual impairments and hearing impairments. So, but I think the chain breaks further down. If the shelter, for example, doesn't have accessible sanitation, people won't come. They will take their chances at home. So then this is additional pressure on the municipality because they still need to attend to those, and we need to audit the full chain and not just the first alert against who actually lives here.
Yeah, and what I find interesting in this one, for example, we all remember COVID and we all remember all the press conferences set in every country. And one of the problems we found was actually in the Netherlands, that during those first conferences, there was no sign language interpreter available, meaning that people who are deaf really missed out on crucial information. Luckily, it started, but now we also see a further decline in applying this. So that's where the continuous feedback loop comes in, because we need to make sure that it's not just for COVID that we had a sign language interpreter, but it's with every crisis which has been announced that we have a sign interpreter. So if we look at first responders, and we were talking in this in preparedness, I was really curious. We have a few minutes left. Can you share a little bit on the work which is done by the police in Abu Dhabi? Because you've been working with them on getting them more ready to support persons with disabilities, and in the case of Abu Dhabi, persons of determination.
Yes, exactly. So my role there I'm part of a working group, but what I can really proudly share is what Abu Dhabi police has been rolled out. So, for example, they developed a VR program, training program for neurodivergent youth on how to navigate the airport. So this is far away from a crisis, but the point here is they inviting people with disabilities to those preparedness trainings. So, and now you can really extrapolate from here, right? And this is exactly the direction that they are taking. Bringing those two groups together and develop together. So not only the neurodivergent participants learn while this training is rolled out, police learns as well while it's rolled out. So this is a really strong and very robust way. And there's also...
And there's interaction also
Exactly.
between them to have to make sure that the police know what to do with a specific person. For example, how to carry, how to...
Exactly, and this is really something what the UAE built, specifically the UAE Ministry of Interior. They established the Secure Communities Forum. So this is an international collaboration where, for example, ARC from the US for people with intellectual disability is involved. And they bring together law enforcement, accessibility professional, disability communities, and really work together on masterclasses for all these groups, while people of determination bring in their own perspectives. And what we are currently really working on are classes and training for neurodivergent population.
So technically, if we bring this together to 3 pointers that our viewers can take out, I think it's the first one, to make sure that you have a continuous interaction, both on policy but also in practice with the disability community, correct?
Absolutely, and I think this is really the point. So you need it on all levels. The entire cascade needs to communicating with each other. There must be a feedback, because at the end, the police officer on the ground will have insights, what works, what doesn't work, and this is beyond the architectural level on how this was designed. And I think this is something we need to acknowledge. It is a participatory process.
Yeah, and closing on that is actually what we always have to think about is, in the end, if we think about the UN CRPD on the Convention on Rights of Persons with Disabilities, Article 4 is about making sure that people are included. But especially in crisis response, what I also found out and what I really learned from having interactions, especially with the deaf community, is make sure that we understand what's happening, make sure that it's communicated in our language. And when it comes to people with learning disabilities or people who experience difficulties in language because of a brain injury, make sure that all materials about flight routes, about what to do in what cases, is also available in a format they can understand. Recently in the Netherlands, we received a book about how to be ready in case of a crisis. And there was nothing about disability in there. And there were also a lot of people with disabilities, for example, looking for information. And there was no information which was really understandable. So technically, for example, as a home, we are prepared. We have our emergency food and water supplies and ready. But so many people don't have because they don't know how to. And it's not just about thinking about what you need to do in a policy, but especially also in your communication and make sure. And that's, I think, the second point we surely have to make. And the third one, train with people with disabilities, because they can train your staff in making sure that an evacuation is being done in the right way, and not just a person with a disability, but look for people with multiple disabilities, multiple experiences, and also in different age groups.
Yes.
I think that's a good
it,
conclusion.
and really start before the crisis decides the timeline.
Exactly. Okay. Leaves me a few seconds to thank you all, and I hope you enjoyed our conversation. And please let us know if you liked our conversation, because we're always ready to learn more. Thank you, Renate.
Thank you, Bianca.